Hello and welcome. I'm Dr. Todd Turnbull. I'm going to perform neurological testing today that will validate cranial nerve dysfunction related to traumatic brain injuries. Neurological tests and exams that we can perform on the patient include the vestibulo-ocular reflex, which is where we're going to have the patient rotate and shake their head side to side. We're doing 2 full rotations, and we're having the patient come back to neutral and stop, and we're evaluating any symptom aggravation or any imbalance or focusing issues that they may have. To demonstrate real quickly, a level 1 out of 4 vestibulo-ocular reflex looks like this. 1 and 2 and stop and focus in on you. You can do this with a phone and document, a camcorder, and document your findings. The bite test, cranial nerve 5. We're going to bite on one side of the molars, clench, and then clench on the other side of the molars. And we're going to compare left and right side. Is there a weakness? Is there a dysfunction? What are we seeing going on there? Let the patient also tell you about any symptom aggravation with that. The cheek puff test. We're looking for the facial muscles, cranial nerve 7, and how weak are those muscles, or are they normal and strong bilaterally. So we're going to puff out the cheek and compress. And we compare left and right side. And we can have the patient do that, and they can sense and demonstrate one is weaker than the other, and we're going to document that. Neck rotation weakness test. We're going to muscle test, have the person rotate fully to one side and try and rotate them back to neutral. We do that left side and right side and find which side is weaker. There may be weakness on both sides. Tongue weakness, cranial nerve 12. We have the patient stick the tongue out and then move the tongue side to side. We can also have the patient push the tongue into the cheek and push on it and test their strength. We can push on the patient's tongue, and we can have the patient push on their own tongue, see which side demonstrates more weakness. Okay. So we're going to have the patient perform the bite test. I'm going to have them bite down on one side of their back molars on the left side, and so bite on there, and then compare and bite on the right side. Right, and you can bite, feel the difference in that. Okay, good. What do you notice is a difference?
I have to think about doing it on the left side. The right side, I can automatically do it.
Good. Let's puff out one cheek and poke on that, and puff out the other one and poke on that. What's the difference?
Right side is stronger than the left.
Okay. And then what I'm going to have you do is stick your tongue out and take it to one side, and now the other side, and go back to the other side, and the other side. Do that 2 times. Good, okay. And now stick your tongue into your cheek, and push on it with your finger, and compare that on the other side. And you can use a couple fingers. Difference?
No difference on that.
Great. On the neck strength test, I'm going to have the patient rotate their face as far as they can to one side, and then I'm going to work on bringing it back to neutral. I want the patient to hold and resist me, hold and resist as I'm pushing back to neutral. Then I have them rotate to the other side, hold and resist as I push back to neutral. I want to make sure that the contact points that I'm touching do not hurt or there's no injury there. Real quick, what I want you to do is just 1 rotation per second. Left, right, stop. And you feel something with that?
Yeah, it makes me a little dizzy.
And you had a challenge focusing or coming back to neutral and holding your balance, yes?
I did.